Great, thank you. Good morning, everyone, and welcome. My name is Stephen Cohen. I'm with the Merowitz Center. It's my pleasure and delight to welcome all of you to this program, which is being co-sponsored with the St. Louis NORC. And we're especially happy to welcome back our dear speaker and guest, Wilma Schmitz. Wilma is the regional liaison and trainer for CLAIM, the state health insurance program for Missouri for the St. Louis region. She presents Medicare topics to people with Medicare coverage and their families, and she manages over 50 volunteers throughout the region. And we look forward to hearing from her what's new for Medicare Part D and Medicare Advantage plans for 2022. Thank you so much again, Wilma, for coming back to speak with us.
Well, thank you. And I'm just pleased to be able to help everyone today. And it's so nice to see faces. And I'm sure I will probably see some people that I know. And I'm here in Olivet. So this is one of my very special groups because I have been very interested in NORC and the J for many, many years. So good morning again. And with that, and thank you for the nice introduction, Stephen, I am going to share my screen. And there are some, if you have questions during the presentation, please place them in chat and we can go through and answer questions at the end as well. So let's get going because there's a lot to go over. So with that, there's a photo of me and pre-COVID. And so I am actually celebrating my 40th year in the field of aging and actually got my start with the Area Agency on Aging back when it was called Mid-East. And one of my spots to work in was information and assistance at the old Covenant House. So I am really connected to the community and I love working with older adults, and now I am one. So I need someone to help me every once in a while. So let's go on. Let's look at the agenda. We're going to talk briefly about Medicare and eligibility and enrollment, but we're going to really hone in on Medicare Advantage plans and Medicare Part D. We will have, I think I have 1 or 2 slides talking about Medigap, because there are some people that may have supplemental insurance and they have to look at their standalone prescription drug coverage right now. And then we're going to follow up with stretching your healthcare dollars. So those folks that are have limited income, there are programs available for you. And you may want to spread this around to friends and family that you know that are about to be eligible for Medicare or that are on Medicare right now. CLAIM. Who's CLAIM? CLAIM is the State Health Insurance Assistance Program for Missouri. We are part of a network of state health insurance assistance program groups throughout the U.S. Anywhere there is Medicare coverage, if it's in the states or one of the territories, there is a state health insurance assistance program. And we're big on acronyms. I think the government was the first to come up with acronyms. So here we are. We are called a SHIP. So if you have friends or family that are in Ohio, for example, there's a SHIP there and it's called OSHIP. So it can get comical with names, and you have to be able to breathe when you're talking about Medicare. So we were funded by Congress to help educate people about Medicare, and that is our sole purpose. We receive funding from not only the federal government, but we also receive our funding from the state government and the Department of Commerce and Insurance. And I actually work for a not-for-profit or a nonprofit called the Missouri Connections for Health. So we've had that contract since 1993. This slide, I want everybody to take note. This is the phone number you call if you have any questions about Medicare. And please be assured that none of the counselors that are claim counselors, we do not sell or promote any insurance company or its product by mandate. And so know that we provide unbiased information. So we have volunteers that are mostly retired, but we have professionals as well that help support and educate the general public. We cover the entire state of Missouri, so we have over 300 volunteers and community partners. So our community partners actually help us get the word out, and we look forward to working with people and helping. So what do? Well, we can help with enrollment questions and billing questions. If someone has a Medigap policy, which is Medicare supplemental insurance, or Medicare Advantage, prescription drug, public benefits like Medicaid, and also appeals and grievances. And one of the things that we do, unfortunately, a lot of is to help people figure out if they are a victim of fraud or abuse. So we can help everyone with these issues, and know that we are trained by the federal government. Last week, we were in training all week, preparing for open enrollment. Part A, real briefly, how did you get Part A if you're on Medicare? You worked at least 10 years, or you were married to someone that contributed to FICA for 10 years. Part A, and if you look at your Medicare card, which is the red, white, and blue card, Part A, for most of us, is no additional cost because we've worked for those 10 years. Part B, right now, for most people, it's optional and it takes care of outpatient. But right now, for 2021, it's $148.50 a month. And if a person has a higher income, they pay more for Part B services. So the deductible for 2021 is $203 a year for Part B. Medicare was never intended to cover the entire cost of healthcare for older adults. It is 80-20 partnership, 80% the federal government and 20% for the Medicare beneficiary. And I'm going to make a side note right here. I have 3 dogs. And they are very Zoom savvy, and they may say hello. So please indulge me and ignore the dogs. But back to Medicare. Most of the preventive services that we'll be talking about is also covered by Part B. If you think of Part A as hospitalization and Part B out services, key factor there. Part D, the newest component of Medicare is the prescription drug plans. And notice in the dark colors that we are projecting that there is going to be a deductible of $480 for some plans. And this is where things get somewhat complicated. Part D is administered by plans, not the federal government. And so things vary. But the federal government actually sets a foundation and says yay and nay, and they are actually negotiating and publicizing as we speak the plans and coverage for 2022. So we are expecting that the projected average plan will be $33 per month, and that they will cover 25% of brand name drugs and generic drugs. So that is where we are right now, is if you're in that coverage gap, better known as the donut hole, that's that 25% max. So we'll talk about that a little bit later. Prescription drug, the average cost for beneficiary, the premium will be $33.37. If a person has a higher income, that will come out soon, and we will be talking about that. And the minimum amount is $2 for a premium. So we're hoping that we can work with you, and if there are premiums, we're going to go for the lowest premium possible, and that's going to cover your medications. So if you're on, for example, there are a lot of people that are on brand name medications, and they're costing a lot of money. I know of one medication that is over $1,000 a month. And so we're going to try our best to find a plan that is going to be at the lowest cost possible for you and give you options. When our counselors talk to you, what they will do is give you 3 options, the best prices that are available, that are going to cover your particular prescription drug needs, and then you are the one to make the decision of which plan you want to go with. This slide is basically showing what is called, again, sorry about the acronym, IRMA. And this shows what a person's income, if you fall within the income according to your yearly income in 2019. So they're going to look back. And if your income was $88,000 or less, you would pay the $148.50. But if your income is higher, you will have an additional charge. Okay. One thing for you to look at, please, 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 if you have not noticed, your mailbox is probably full with plans. One, saying that it's time to compare. You also should have received a notice of changes in your Medicare Part D. And if you're on a Medicare Advantage plan, changes that are coming about. The plans had to start mailing information, and it should have hit your mailbox October 1st. So if your mailbox has an increasing amount of mail in it, it's because all the plans have your name and address and your age, and they are going to try to woo you to their plans. So please be careful when you look at all the sales that are coming into you when it comes to Medicare. Mark your calendar. Starting October 15th, you can actually look at the plans and make changes that will go into effect January 1st, 2022. One of the things that I encourage people to do is to call your primary care physician, any specialist you have. Also, look and make sure the hospital of your choice also accepts the plans that you're looking at. And we're talking about folks that are on Medicare Advantage. Okay. So all those changes go into effect January 1. And if you have you find out, you sign up for a plan only to find out in January, when you go to the doctor, you make an appointment to go see your primary for the first time in 2022. Oh, we don't accept your plan. Call our office right away, because you have the ability to switch only once if you have a Medicare Advantage between January 1 and March 31st. So that's what that last part of that table is all about. So a lot of people think they found the best plan because their neighbor, their relative has said, this is the best plan ever, only to find out that there are some plans that the hospitals of choice don't accept, and doctors don't accept. So you want to make sure you got that ready. This happens every year. So no, every October 15th, you will get a chance to look at your prescription drug coverage. And if you are in a Medicare Advantage plan, you get to see, make a comparison, see what coverage is there, see if the doctors are there, look at the cost, out-of-pocket cost versus plan cost, so that you can actually make a choice that's best for you. You will receive, or you should have received, an annual notice of change. That comes, it's usually labeled. My husband's on Medicare, and I saw his right away. So I went, aha. And then I explained that to him, and he said, you take care of it anyway. So tell me what I need to do. And I said, okay, you're fine. We'll work on this. And also it explains any changes that are coming about. Some plans actually are leaving Medicare. I think Missouri has lost 5 different plans. So we want people to be aware of that, because the last thing you need when you're going to the doctor, or heaven forbid, you are sick and you're going into the hospital, to find out that you aren't covered at that particular service. So we want you to make sure of that. So when it's time to sit down, and hopefully you'll call us, and we're going to ask you some questions. We want to be able to help you fit the coverage that you need, that you want, supplemental coverage when it comes to Medicare Advantage plans, prescription drugs, your doctor's choices and everything, and also travel. And one of the things that you have to understand about Medicare Advantage plans, if you're a snowbird, you need to talk to us, because you can only have coverage in one place. if you have a Medicare Advantage. So if you're fortunate enough to be able to spend 4 months, 5 months in a different state where it's warmer, like Florida, you may have a problem because your coverage stays with your home address. So you want to really talk to us and think about what your plans are. If you have any changes, let's say you're still working or you're covered by a spouse's insurance, employer insurance, and you are going to lose coverage, talk to the HR department, get and hang on to all the information that you that they can give you, that you're given, so that you know what your coverage is. So we want you to be prepared for everything possible. And we will work with you to make sure that you have the coverage and you have a working understanding of Medicare. So please be careful and hang on to all those documents from HR departments or your union. I bet you've received or you will be receiving the 2022 Medicare and You. This is when I say to everybody, if you have old copies of Medicare and You, you can recycle those because those end on the 31st of every year. So you can actually get rid of those. My mother is going to be 91 this month, and I was amazed at, we were talking, and she pulled out a Medicare and You from 1997. And I said, oh, Mom, you don't need this anymore. And I said, we're going to get rid of those, and let's get rid of all those phone books that you still keep too. We need to clean out those things because they are dated. You will receive the annual notice of change or evidence of coverage. Please call us if you have questions, or you can call 1-800-MEDICARE. One of the things that we have the option, Claim has, all of our counselors have a dedicated line to Medicare. So if you called 1-800-MEDICARE, there's a good chance that you will have to sit online for several hours, because think of all the people that have questions about Medicare. One of the great things that we have is our counselors have been certified, so we have a special phone number, and even to some of the managed care plans, we actually have dedicated phone line to them as well. And there are 2 of us in Missouri that can actually call the Medicare regional office if there is a complaint. So there is an advantage in talking with us if you have any questions when it comes to Medicare. The Medicare and You Handbook is mailed to all beneficiaries each fall, and it's a good, quick comparison. And I forget how many pages it is, but you should have received it. If you haven't received it and you didn't opt for an electronic version, we actually received 3 palletfuls in our Columbia headquarters last week, and we will be happy to mail it to you. So you can just call and the 800 number and say, hey, you know, I didn't get my Medicare and You book. Please, will you send it to me? We can actually get it to you in several languages, and also large print. So please give us a call. The plan websites, every plan has a website. Unfortunately, they do not, and the federal government don't realize that not everybody has computer access or feels comfortable with dealing with computers. You can find phone numbers to the plan websites. Say you have kids that are going to help you to formulate your questions, so you can ask us, or they're looking at your Medicare and You Handbook. All those things are there to help you make a very informed decision about what's going to happen to your healthcare coverage and prescription drug coverage come January 1. Now, if you decide that you're going to change plans, one, take a deep breath, do a comparison. And if you decide you're going to do that, you can either call the plan, you can go on the website. Our counselors can actually do a three-way call between you and the plan so that you can get enrolled. One thing that is not on this slide that I really want to have you, besides the phone number to claim, to always remember, no matter what you do, have a notebook, a dedicated notebook that you can write down the date, the time, who you spoke to, their extension or their ID number, and what was said. Because if there's any type of problem, that's what's going to be asked: who, what, when, where, and how. If you change plans, you should get a confirmation number. You don't have to call the old plan and disenroll. You don't do that. The plans send information to Medicare. They are able to discern which plan is going to be the plan for 2022. And you don't have to disenroll. Never, never disenroll. Call us if you have a question. If you call the plan, you want to get a confirmation number. Again, get a confirmation number. Our counselors will work with you. And if there's, let's say, December 31st, you still haven't received your paperwork from a plan, having that confirmation number, our counselors can get through the plans right away and either give you a temporary card number or make sure that you have that coverage come January 1st. Please remember that. So if you need services, make sure for the first 3 months or so that you carry your red, white, and blue card, your Medicare card. You need to also have a photo ID. My husband is in St. Luke's Hospital right now, and they ask for anybody that's going to be coming in, you have to have a photo ID and a vaccination card. So that's a new thing that you need to carry with you. If you have old cards from, let's say, 2020 and older, please get rid of those cards, because every year new cards are issued, and that will complicate things and slow down the process, and you could possibly get a bill for something that you shouldn't be getting a bill for. So you want to have the confirmation letter or a card when you go and see the doctor. You also, if you have any type of extra help, which helps you pay for your medical care, you can actually get at that, have that with you, so there's no complications. If enrollment can't be confirmed, you may have to pay for services out of pocket and work with the plan to get reimbursed. It's better to work things out ahead of time than to try to get reimbursement, because there was an article in that came out just this morning that it's harder to get reimbursed because of all the things that are happening with billing and trying to sort things out. So Kaiser Health News came out with an article that hospitals are having problems with the plans, so are beneficiaries. So you want to make sure you get things cleared up from the very beginning, so you don't have to try to get reimbursed for services that you're going to be asked to pay for. All of this is all the new things that are coming out. Medicare coverage for COVID-19 related services. It's taken everybody a little while to gear up for all these things, but there are some charges that are covered by plans. Ask and make sure you get paperwork if you're asked to pay for services related to the for vaccinations, testing, all those things that are connected with COVID-19. There is going to be more scrutiny, making sure that people are getting the authorized, cleared services. And believe it or not, and you probably would believe that there are scammers out there and there's billing problems. So you want to be very aware of what's going on and what medically necessary services, definitely hospitalizations that are going on. And by the way, FYI, my husband is not hospitalized for COVID related. He has another medical condition, and that's why he's in the hospital right now. Hospital price transparency. It's now federal law. Any hospital that accepts Medicare payments, which is the majority of the hospitals, have to provide a list of services. So there's no more surprise billing. And we've all heard about it, where people went in for some reason and they came out with a bill that was just horribly high and they had no idea. So now federal law says that you can look, you can ask for a price list. That way, if there's a hospital that charges a lot more for the same services, and you have a choice. So that is a wonderful and empowering service and duty, actually, that we all have, because we have to we're shoppers for services. So please, you can ask questions, and our counselors can actually bring up the list for you if you don't feel comfortable, or if you're not too sure how to do those things. So that's important. So I just said a lot of stuff real quick. And are there any questions? We have some more slides, but I want to make sure that if there are questions that we can answer those
Actually,
right away.
Wilma, there's in the chat, Stan has asked, I have TRICARE for life, And can you please discuss how this works with an Advantage plan?
Ooh, number one, TRICARE for Life is for folks that have coverage through the federal government, either from military service, and then there's a component for those that have worked in the federal government as well. For the most part, folks that have TRICARE for Life don't need to have a Medicare Advantage plan. TRICARE for Life is as good, if not better, than Medicare. I would suggest there are pamphlets that we can send to you. I would also suggest contacting the Office of Personnel to make sure you know what your coverage is. And in most cases, TRICARE for Life is, again, as good, if not better, than Medicare coverage. Other questions so far? Oh, okay. Yes, someone's asking about penalties for sign up. If you have not signed up for Part D, there are penalties associated with that. And the penalties are calculated according to the number of months that you were eligible for Part D and didn't sign up. So for example, if when Medicare Part D was rolled out in 2006 and 8, they person didn't take any medication. Why should I sign up? They didn't sign up. Now they have medication and they have a penalty because they were eligible and chose not to sign up. If you're not taking medication and you are newly eligible, or if you have a special enrollment, you need to sign up, talk to us so that you can avoid penalties. And there are some circumstances, if your income is limited, you may qualify for a program that would eliminate any penalty that you could occur because you didn't sign up in time. So give us a call. Our counselors will be able to help you. Look at what your options are if there is a penalty, so you know what your penalty is up front. But it's best to sign up as quickly as possible. I see there's another question about it's easy to move from supplement. I understand it's easy to move from a supplemental plan to Medicare Advantage, but not easy or impossible possible to move back. Okay, good question. Thank you for asking. Medicare supplemental plans are the before Medicare Advantage plans, and even now you can go and get a plan that you know every month you're going to have a certain amount of money to pay for your plan. You don't have, in most cases, any co-pays. You don't have to pay the doctor when you go see the doctor or a therapist. And there are letter plans as well. And there is a book that's called the Medigap Shopper's Guide. We can send this to you. It's on the Missouri Department of Commerce and Insurance website. And if you have a Medicare supplemental plan and you want to go to a Medicare Advantage plan, you can do that, but it's not easy. And plans, usually when people are in a supplemental plan, they stay within the supplemental plan. But if it's because of budget or whatever, we can work with you to make sure you get a Medicare Advantage plan that is going to be able to suit you. If you are just turning or becoming eligible for Medicare because of age, or if there are circumstances that you have left employment and you had employer's coverage, you have a window of time that you can make your Medicare choices, and that we want to be able to help you know your options when it comes to signing up for any type of Medicare product, be it a supplemental plan known as Medigap, or if it's a Medicare Advantage plan. It depends, and one way to look at the way, what's the difference? Supplemental plans, you pay a set amount every month. Every year with the supplemental plans, you have an anniversary date, which is separate than your Medicare prescription drug coverage. Supplemental plans do not have drug coverage built in unless you have a really, really old plan that you've had for many, many years. Part D, standalone, time to look now at what's going to happen in the future if you have a supplemental plan. On the other side of the, if you can imagine a fence, there is Medicare Advantage. Medicare Advantage rolls Part A, Part B, and in most cases, prescription drug plans all together. So it's a bundling effect. And when it comes to Medicare Advantage plans, you do have co-pays, you have co-insurance that you have to pay if you go into the hospital. But it's month to month, it's more affordable for some people to have a Medicare Advantage plan. So it depends on what and how you want to pay for your Medicare. So it's important to understand the differences. Not everybody, Medicare is very personalized. So no matter if you're married to someone that has Medicare, what their needs are is different possibly than what your needs are going to be. So let's move on real quick here.
Actually, Michael Gold had a question and he was trying to type, but he is available right at the moment to ask his question.
Well, that would be great.
Okay, thank you. Wilma, I have two
Yes.
questions. The first involves the drug donut hole. The initial coverage, let's say 4,000, and then the catastrophic is 6,000. In between the two would be the donut hole. In order to get to the 4,000, is it correct to say that your copay, your payment for the drugs plus what the plan pays together comes to the $4,000 limit? Once you exceed that, the drug plan cost is eliminated, and then your cost to pay for the drugs plus maybe some Medicare help or other third-party help to get you to the 6,000 price. So is it correct to say that the Medicare Advantage or the supplemental drug plan, they will drop off what they have paid in the donut hole, and it's just what you pay and any help you get from a third party to get to the catastrophic limit? Is that correct?
The changes that happened effective in 2021 is that the coverage gap has our donut hole has been reduced, where the person is responsible for 25% of the cost, not 100. So it's gone. So there is some coverage, but little. I mean, not little, but 25% until you meet that catastrophic coverage. So there is a limit. And then you go into catastrophic. And in some cases, the medications are such that if it's a brand name, a person can go into that coverage gap as early as March. And it depends on what medications are used and taken. So you want to check with us and make sure that you know where that gap is going to, when you're going to go into that coverage gap. The Medicare Plan Finder actually will give you an estimated month that you would possibly go into that gap, but it's the person is responsible for 25%. And that's when we do work with people to try to find additional coverage for them through the prescription assistance programs. And there are some not-for-profits that offer coverage as well. But it's we work with a person if they have a very high drug cost, so we can try to find a program that will help them make it through that that gap period if they have catastrophic. Does that answer your question?
Well, I was more concerned with the cost, knowing what the cost is that I pay, plus what the plan pays, adding those two together, that gets me to the minimum of the, or to the maximum of the initial coverage, which is the floor of the donut hole. When I'm
Correct.
in the donut hole, what dollar amounts are applied up until to get me to the 6,000 catastrophic coverage? Is it my cost less or not including the drug plan cost plus any third party that pays to get me to the 6,000? So let's say that the drug company and I pay $4,000. Okay, from that point, and I paid $2,000, let's say, and they've paid $2,000. At that point, at the $4,000, their $2,000 drops out, and I've paid $2,000, which means now I have to get to $6,000 or another $4,000 to meet the catastrophic. That additional $4,000 would also be consist of my pay plus a third party, like, for example, Medicare might pay or some other entity might pay. The point is that does the drug plan company, let's say Medicare Advantage or the Part D drug plan, does their price that they've paid to get to the 4,000, does that drop out in
No.
order for you to get to 6,000?
It is calculated when you pay the 25% of that cost. That is calculated with the cost that they're continuing to pay until you get to that catastrophic. So it's always the max that you will pay is 25%. And there are some instances that you would pay less.
Okay, my next question would be, once you sign up for a plan for 2022, and you have all your confirming documents, everything's in order, effective January 1st, 2022, you have the plan, you have the documentation. Can the Medicare Advantage company or the Part C or D company, supplemental Medigap, can they cancel your contract with and take you out of the system anytime during the year?
No, the
Okay.
only way you can lose coverage is non-payment. And first, let's go through the ones that the different options. Original Medicare, which is Part A and Part B. The only way you can lose coverage with Part B, which is outpatient, is if you don't pay that option. Okay. So as long as you pay, and most people have it taken out of their Social Security check or their railroad retirement check, so they don't even think about Part B payments because it's right there. It's taken out. If a person has a Medicare supplemental plan that is also known as a Medigap, the only way that you can be kicked out is if you don't pay.
Okay, thank you.
And with Medicare Advantage plans, again, if you don't pay, you will get kicked out. If you are, I think I alluded to this a little bit earlier about with the supplemental plans, you have an anniversary date of when you purchase that plan. So usually people buy plans around their birth date. Every year, you're notified of what those costs are going to be. And at that time, you can look and change within that letter plan. So let's say that you had letter G. You can change within that letter plan and find if there's a plan that's less expensive. So if you have a supplemental plan, you hopefully understood what I just said. Medicare Advantage is open enrollment is October 15th through December 7th. There's some other questions that I'm looking at in chat. My first year hearing about this, do you sign up again? Our coverage is renewed. Okay. Wait a minute. Let's see. Okay. I need the person that wrote my first year having to do this. Oh, okay. I get it now. What you need to do is, depending on, I'm not sure if you're asking about Part D or if you're talking about Medicare Advantage or supplemental. If you have just turned 65 within the last 6 months or so, you should call us, look at your options for Part D, if you're going to go with a supplemental plan, or if you're going to go with a Medicare Advantage plan. The goal is that everybody wants to have coverage. 20% can get pretty high, and 20% of hospitalization can get pretty high real quick. Doctor's visits and all those services. So you want to make a decision. Sometimes it's hard to make a decision. You need to do your homework, but you need to not stick your head in the sand, which a lot of people, including myself, would want to do. But you need to get in touch with us to have that, have your options laid out for you. There is a question someone had that's on Galaxy tab A. They have a question.
She said she would unmute herself and ask the question,
That's
I
fine.
believe. Yeah.
That'll be fine. Yes, please.
Oh, I'm not sure if she's available, but we did have one other question from Deb Crowder too on the chat. Does Medicare, I don't, maybe you covered this one. Does Medicare Part D coverage immunotherapy or chemotherapy for cancer treatment? And how would that work when a single treatment could cost greater than 20K?
Okay. With cancer treatment, that is under Part B. That is the, so even though it's outpatient, it is not covered under Part D as in drugs. It is covered under Part B, and in some cases, Part A. So what I would say to anybody that is having immune suppressant therapy or going through chemo is to contact the social worker that is at the various cancer treatment centers. And they have, one, they have information. And two, if there is a problem, which we've had to go and talk to Medicare about some of the plans that were denying coverage for some things. We will go to bat if there is a problem, but please talk to the social workers because they know that is a situation that they work with people every day. Let's see. Libre is device which is to test glucose monitoring on a ongoing basis. So it sticks to your skin. You can check with your plan, or if you don't check with them, we can check for you. In most cases, the Medicare Advantage plans and Part D do not cover Libre. It doesn't, and in some cases, Part B may. And so we want to be able to help you make sure you know. But in most cases, I've had people that Medicare has said no. There are other options for people, and we have to do appeals to get those types of coverage. So let's see. Another question is, if a renewal, do I have to sign up again? And, okay, you don't, this person is saying that they're 83, congratulations. I don't want to have to lose coverage. Will it automatically renew? Do you need a signature? Okay, I'm not sure if you have Part D or if you're talking about supplemental or Medicare Advantage. As long as you pay, you will not lose coverage. If a company is going out of business, you have an option to sign up for a new company, but you want to give us a call so we can make sure that you have that information. Okay, and then there's a question about TRICARE is considered a supplemental plan. I would say with TRICARE and other insurances, including union coverage and employer coverage, give us a call. First, before you give us a call, talk to your benefits people at your employer or with TRICARE, the Office of Personnel, to make sure you know what your coverage is. And if you have questions about adding on to it, we can help you with that. But in most cases with TRICARE for Life, it's not considered a supplemental. It's better than Medicare in most cases. So please be careful about that. When it comes to Part D coverage, you want to really check with, make sure you have a coverage with that as well. Let's see, we have another question. If you have a financial problem, can you appeal to the hospital for financial aid? Yes. Most of the hospitals have a coverage, or they can offer you a payment plan, and it's to help, because they know that not everybody can pay out of pocket right away. So you want to check with them and ask for, there's a service coordinator or a care manager, and just let them know that you need to talk to someone about making payment arrangements. There's another person that asked about Part B and Part D can't be canceled as long as you have Part B taken out of your Social Security or your railroad retirement. Your Part B, if it's taken out, you never see it. When it hits the bank, it's already taken care of. You want to double check with us, we can check for you. And Part D plans, you have a chance now to look at your Part D. And as long as you're satisfied with what you have, you can maintain that as long as you pay your premium. And that's a big thing. So what I want to go through real quick, because I know we're running out of time, is that there are ways to help you if you have limited income. Social Security offers for people that have limited income, it's called Extra Help through Social Security. And we can help you sign up for that. And zero premium for Part D, and eligible for help reduce the co-pays and co-insurance. So that's a really good thing. There are other programs that are available to help you pay for your Medicare premium, your deductibles, and you can get auto enrolled as well. So let me show you real quick. This is for this year. So on the left hand, or at the top, there are the different programs. Then look at your income, what your monthly income is. And this is gross in most cases. If you're a couple, that's that next line. And then resources. So if you fall in between any of these, give us a call and we can help you sign up for Medicare savings program and Extra Help. Understand that everything you say to us is confidential. All of our counselors are required to have shredders. And once we've helped you and document what we've done, everything is shredded. Okay, there's that phone number again. If you know someone that has end-stage renal disease, Missouri is one of the few states that actually have a program, and it's through the University of Missouri, that can help you find the plans and make sure that you get the coverage that you need for any type of end-stage renal. Then one of the very last things that I want to talk to you about is please, please, please don't give out your information to anyone that you haven't called the service first. Quick story, it's talking to the regional manager of Medicare based in Kansas City. He just became eligible for Medicare. A scammer called him, asked him for information. wanted to know his birth date. They wanted to know his Medicare number and also his Social Security number. And the scammer said, we're from Medicare and we're calling to verify your information. Can you give us? And the guy said, I work for Medicare. Who are you? Click. Okay. There are people out there trying to fraud, trying to scam. Medicare will not call you without you calling them first. Social Security will not call you unless you call them first. And it's a follow-up call. This is another important number you could call. This is the Senior Medicare Patrol. They are governed by the federal government and the state government as well. They can help you if you suspect you have you've been scammed. If you think that this sounds too good to be true, call them. Put that in the back of your mind. Is this too good to be true? If it is, if you think it, your hair stands up on the back of your neck, hang up. Do not try to harass people and say, stop calling me and giving them your 2 cents worth, because that can cause more problems for you. Call Senior Medicare Patrol. I was telling Stephen earlier this morning that I was involved with helping an individual that had been sent medication that, 1, was not a prescription, 2, from a doctor that she did not know, from out of state. There is no reason for pain medication, Bengay, to be administered by someone in Kansas. Turns out FBI was involved, called me because I had actually spoken to this doctor to try to find out what was the story. And now he's being federally indicted. So it does work. The system does work. Just give us a call if you have a question. You're on the computer now. If you want to sign up for Medicare.gov, always G-O-V at the end of Medicare. If you go to Medicare.com, that's an insurance company. Medicare.gov, you can actually look at your plans, what you have now. You can look at your what Medicare has paid on your behalf. And you can find out a lot of information. So Medicare.gov. In summary, Medicare is not a one-size-fits-all. Medical needs, situations, everything is individualized. Please don't make a decision because of a commercial, because of a neighbor, family, friend. Please get an unbiased opinion before you do anything, and that's what we're here for. We have a lot of counselors that are retired individuals that feel that they want to give back to their community and their neighbors by becoming counselors. We have folks that help with administrative support. And there is a program called AmeriCorps that some people are interested in that will help defray the cost of, there's a stipend given to help family members to pay for education. And also they receive a small stipend for helping us. If you're interested, you can give us a call and you can say, hey, I want to hear more about AmeriCorps. We have a coordinator that can help you with that. This next slide is our phone number again. Our website is missouriclaim.org. You can send emails and you can say, you know, heard Wilma speak to, and I have a question. They will direct it to me. If you look at the screen, you can see Region 2. That is the counties that I cover, and I have counselors in most of the counties. So you want to talk to a counselor, you can ask for a counselor in Region 2, and they will help you. If it's a complicated case where we have to talk to the state or the federal government, that's when I get the calls, the complicated calls. So you can call the claim office. They will make a referral. You will hear from one of our counselors. They will say, I'm calling from the Missouri State Health Insurance Assistance Program. And they will say claim, and they will be able to help you with anything that is Medicare related. And if they don't know the answer, they will research it, call me, call one of my colleagues, and we will get the answer for you. So I know that I have just given you a lot of information. If you have questions, you can ask. I'm here, so you can ask right away. I know some people have other obligations, but I'm willing to stay around for a few more minutes if you guys are.
Wilma, someone wondered, can they call you directly, and how would they do that?
Well, calling me directly is kind of hard to do right now because I'm in the midst of open enrollment. It's best if you have a complicated question to call the claim office, and you can ask for a referral. It would be, I wouldn't want to hold you up because I know right now I've got 5 cases that are complicated that I'm working on, and we're doing training. So I want you to get your answers as quickly as possible. And so that would be probably one of my counselors, and they will be able to help you. So rather than give you my phone number directly, you would get voicemail right now, and I want to be very honest with you. So you can always call claim, and they will either give you to one of our experienced counselors, or if it's something that it's a complicated case, you can ask them to refer your call to me, and that's how we have to do it right now. So sorry, I'd rather not hold you up if you have questions that need to be answered right away.
I would like to just make a comment in support of your claim counselors. I've heard a lot of people that have contacted a claim counselor, and they were very knowledgeable and very helpful. So I just want to support you, Wilma, and just let you know that I've heard several people have really good experiences with your claim counselors. So
Oh, thank you.
you're
Yeah.
welcome. You're welcome.
Oh, I see there's a question about Medicare in California. There is a state health insurance assistance program in California, and you can actually call the claim office, and they will connect you to a counselor, give you the phone number to call for any state that you have questions, because there are a lot of us that are caregivers that have family members in other states. We can get you connected. So thank you. I see there's some comments here. Thank you.
And there's another question, Wilma, and you might have missed it, during the month, during what months can someone who is turning 65 sign up for parts of Medicare? Example, 3 months before the month of birth, or what?
Okay, I'm sorry if I skipped over that real quick. So when you have 3 months before you turn 65, the month that you turn 65, and 3 months after you turn 65 to sign up for Medicare. Those of us, I'm one of the baby boomers that's going to be turning 65 next year. So we will go on Medicare before we are eligible for Social Security. Medicare will make arrangements to for payment for Part B, and until Social Security kicks in. Social Security for me won't kick in until I'm 66 and 6 months. So, and that is, so I will have to make payments. And then there are some situations that teachers also have to pay directly into Medicare Part B if they worked in the public school systems here in Missouri. So that's what I mean when I say Medicare is so individualized. You want to, everybody has a different story, how we got to where we are now. So you really want to talk to a counselor, but to answer that basic question, 3 months before, the month of, and 3 months after. So I hope that answers your question.
Thank you, Wilma. This is such a packed with information program. There's so much information. I would also like to welcome Laura Press-Milner, who is the NORC Activities Coordinator, and she would like to share a few things with the group today as well. So Laura, please unmute yourself, and there we go.
All right. Well, thank you, Judy. Thank you, Wilma. For many of you who don't know this, we have a wonderful relationship with Wilma, who has graciously come year after year. I'd say at least, well, anyway, at least 15 years we've had a relationship with Claim. And I can't stress enough how much information she shared with you, but just imagine how much information and expertise Wilma has. I mean, she's amazing. And of course, we all would love to sit down with Wilma and do one-on-one sessions. I want to stress the volunteers are fantastic. Those volunteers that serve our members have been fantastic through the years. As Judy mentioned, she's heard wonderful things. I also hear wonderful things. So I want to stress, call the number. I know it was given over and over. If for some reason you need that number again, call me. I have it handy. I can give it to you. You will have success with a wonderful volunteer. And Wilma, again, thank you so much for coming out today and sharing your expertise. Judy and Stephen, thank you for coordinating so much of this program today. It wouldn't have been possible without the Merowitz Center and their support. I believe this has been recorded. So again, I think Judy mentioned it is available. It is recorded. So all this recorded, listen to over and over and over again. If you're one of those people that need to have things repeated several times before it sinks in or starts to register.
I also want to remind everyone too, Laura, that Wilma has sent me a PDF document of this presentation, which I will email to everyone that was here today and registered for the program. So that will also give you a document in your email that will have the numbers, phone numbers, and information that Wilma shared today. So there's a couple of different, supports for what you've heard today.
Well, Judy and Stephen and Laura, it's always a pleasure. I will, reach out to you, call me, get in touch with me, and I will help as much as possible. I think Laura is going to have some goodies that are going to be coming out real soon from CMS. And so can I tell them? Can I tell them?
Please.
Okay. Everybody that is on this call, everybody that is a member of the NORC system, and we'll make sure, Stephen, that you get some of these too. Medicare gives out beautiful calendars every year, and they are large enough that you can write appointments on. You can, and just award-winning calendar. And so I'm expecting my shipment, and I'll be sharing that with both the Merowitz and the St. Louis NORC. And we will make sure that everybody has these calendars. It's a fantastic resource, and it's beautiful photos. So I'm looking forward to my shipment, and I will make sure that you guys get them as well.
Wilma, I think there was one last question that maybe we could, Galaxy Tab has her hand up. I'm not sure what your name is.
Gloria.
Gloria,
Yes.
if you could, do you have a question?
Yes. Right from the beginning. Thank you for acknowledging it. So I was asking Wilma, but I did not write it or type it properly. There's two devices, Freestyle Libre and Dexcom. It's devices that you insert in your arm or in your belly. They're very expensive and they're not drugs. So what do they go under?
Those go under, it normally goes under Part B if it's covered. In some cases, it is not covered. I've had a lot of problems trying to get it covered because Libre itself is a brand rather than the device itself. So some plans have other devices, but they're the same type of concept.
There's other devices like Freestyle Libre in the market now?
Yes, there are.
I have never heard of them. I heard of Dexcom, Dexcom.
Yes, that's one of them. Those are the two
The last
most.
one that came out.
Yeah, that's what a lot of those, that's the one that a lot of people have and that Medicare Advantage plans cover. The Libre has does the same thing, only it's more expensive. So if you have that, you want to make sure, or if you're prescribed that from your doctor, please make sure that it's covered.
Well,
Okay,
Wilma,
I'm not happy or satisfied with Freestyle Libre. Sometimes they work, sometimes they don't, and they're extremely expensive. And my question to you earlier on the typing, it was about Dexcom, Dexcom. So I don't know how to go about getting that and changing it from Freestyle Libre to Dexcom.
You would need to talk to your doctor and also your pharmacist, and they can work it out so that you have the machine that you need.
okay, thank you everyone for coming today. And thank you so much, Wilma, for all the absolute wonderful packed information that you shared with us today. And again, this was recorded, it will be available, and you will receive in an email the document of this PowerPoint today as well. So you'll have contact information for the claim office. So again, thank you so much, and everyone have a nice afternoon. And thank you, Wilma. Thank you, Laura. Thank you everyone for being here today.
Take care, everybody. Bye-bye.